Hi everyone, so we're going to cover the skin and the fascia of the anterior abdominal wall. So skin, I've already told you that it is pretty stretchable and it has the capacity to stretch to its maximum extent. Now when you talk about the fascia, anterior abdominal wall, it has a superficial fascia and a deep fascia. The superficial fascia, it is divided into two parts. So right here, let's read out this. It has a campus fascia, which is the superficial fatty layer, and this is thicker. And then it has carpa fascia, which is a deeper membranous layer, and this is thinner, right? So superficial fascia is divided into campus fascia and then scarpa's fascia, right? So campers and scarpa. Campers means fatty layer and scarpa is the membranous layer, right? And also one thing is that the scarpa fascia, which is the deeper layer, it is continuous inferiorly with the fascia of the perineum. What's the fascia? Which fascia of the perineum? The superficial fascia of the perineum, and that is known as Colles fascia. So those of you who do not know about Colles fascia, it is right here. This is the superficial fascia of the perineum. So the deep fascia of the interior abdominal, the superficial fascia of the interior abdominal wall, it is divided into two parts. Campus fascia, which is the superficial fatty layer, and the scarpa fascia, which is deep membranous layer. So the deep part of this, which is carpus fascia, it is continuous inferiorly with the Colles fascia, which is a superficial fascia of the perineum. I hope it makes sense. For now, you just need to know the names of all of these fascia, right? Do not now confuse this to the Colles fascia. Colles fascia, if you can recall, when we were studying the head and neck anatomy, there I told you that we have deep cervical fascia, which is the fascia of the neck. It's also given another name, fascia colli. So that's fascia colli, and this is Colles fascia. So fascia colli is the deep cervical fascia of the neck. Do not confuse it with that. Now moving forward, here you can see that campus fascia, superficial fatty layer. In males, it becomes the fatty layer of scrotum, and it's also replaced by the dartos muscle. And in females, it contributes to labia majora. Whereas when you talk about scarpus fascia, so there's one thing you need to know. There's a clinical related to it, that Colles fascia here. So urine extravasation is the clinical. So rupture of urethra, urine spreads between scarpa's fascia and deep fascia. So scarpa's fascia and the deep fascia, it does not spread to the thigh because scarpa's fascia attaches to fascia lata. So fascia lata is this fascia of the thigh. So it ensures that it doesn't spread to the thigh region or to the lower limb, right? So where does the urine remain? It remains between the scarpa's fascia and the deep fascia. This is in cases of urethral rupture, right? And membranous layer, here they're saying that Colles fascia, the attachments of scarpa's fascia of the abdomen and the Colles fascia of the perineum are such that they prevent the passage of extravasated urine due to rupture of the urethra backwards into the ischiorectal fossa and downwards into the thigh. So backwards into the ischiorectal fossa it won't go, and downwards into the thigh it won't pass because of thanks to our scarpas as well as the Colles fascia and also to the fascia lata, right? So this is the clinical. Okay, so we're talking about the cutaneous innervations of the skin in the fascia, so or the anterior abdominal wall in general. So anterior abdominal wall को उसकी innervation मिलती है by lower six thoracic nerves and L1. Lower six thoracic nerves मतलब T7 to T12 और L1, ठीक है? अब जो thoracic nerves हैं इन्हें कहा जाता है intercostal nerves, but not the T12. इसका नाम intercostal नहीं है, तो मतलब lower 5 intercostal nerves हो गए. T12 का क्या नाम है? इसको कहते हैं सब कोस्टल, क्योंकि ये कोस्टल मार्जिन के पास आती है, तो सब कोस्टल उसके नीचे आती है, तो सब कोस्टल, ठीक है. और L1 क्या है? इलियो हाइपोगैस्ट्रिक नर्व, ठीक है. तो इलियो हाइपोगैस्ट्रिक, सब कोस्टल एंड लोअर 5 इंटरकोस्टल नर्व्स. तो ये होगी क्यूटेनियस इनर्वेशन ऑफ द इंटीरियर abdominal wall, ठीक है. अब आर्टीरियल ब्लड सप्लाई कहाँ से मिल रहा है? एंटीरियर क्यूटेनियस आर्टरी, लेटरल क्यूटेनियस आर्टरी, सुपरफिशियल इंग्वाइनल आर्टरी से, inguinal, then superficial epigastric artery से, superficial external pudendal which supplies the genitalia, superficial circumflex iliac, ठीक है. अब lymphatics के लिए there is a very good diagram 16.11, उसमें दिखाया हुआ है कि कैसे if this is a person, तो उनकी यहाँ there lines, right, lines of Holden, and then you have the umbilicus और यहाँ ऊपर you have the रिब्स, ठीक है. अब यहाँ बीच में देयर इज अ वाटरशेड लाइन, इसका मतलब है कि यहाँ के लिम्फेटिक्स नीचे वाले के नीचे में ड्रेन करेंगे, ऊपर वाले के लिम्फेटिक्स विल ड्रेन ऊपर वाले में, है ना. मतलब लिम्फ नोड्स लिम्फेटिक्स में जब ड्रेन करते हैं उसकी बात कर रही हूँ. तो ये है आपका दो लिम्फ नोड्स का ग्रुप है, एक ये एक ये. तो दे आर सेइंग दैट lymphatics also pay due respect to the watershed line which is right here above the level of the umbilicus. The lymphatics run upwards to drain into the axillary lymph nodes. So यहाँ के lymphatics will drain in the axillary lymph nodes जो भी watershed के ऊपर वाले lymphatics हैं, ठीक है? और the lymphatics below the watershed line they'll drain in the superficial inguinal lymph nodes, right? So yes, superficial inguinal lymph nodes, and you have the axillary lymph nodes. So yes, that's about it.